Hi, it's Dr. Dan Ronel. You're listening to Talk 1260 KTRC. This is Western Medicine, a show about plastic surgery. And we're going to talk about some personal fitness tips today with Alana Bader from chiselfitness.com.
We've been talking to her, and so one of the other things I love about her, sadly, is she takes the obstacle out of working out. She has shown me things that I can do, like while I'm waiting for my water to boil to make pasta or whatever. I don't eat too much pasta at night, but you know what I mean, waiting for my vegetables to boil. She's taught me to do push-ups on my kitchen counter. She's taught me to lift soup cans for tricep extensions, whatever they're called, you know, all that kind of stuff. So that's what I love. She makes it easy for the everyday person to work it out, work themselves out, and look good and feel good.
All right, good.
Well, that's definitely one of the best ways to get in the habit of something is when it's in front of your face every day.
Right.
You can't avoid it. You know, people believe, some people think they need to have all this fancy equipment and top of the line, state-of-the-art equipment. That's not the case at all. There's so many things in your home that you can do, that you can utilize. You know, like she said, kitchen counters, steps in your home.
Right.
You know, any type of exercise ball, and you don't even need a mat. I'm sure everybody has a carpet or a rug somewhere down in their home, and
right.
Yeah, and you can really utilize anything. A lot of people, yeah.
like what's an example? And I have a lot of patients who have had a tummy tuck or a liposuction, and they've healed well, and then they ask me, you know what, I really want to firm up my stomach. I want to sort of protect my investment. What's something that they can do for their abdominal muscles?
Well, anything is good. Any athletic activity. A lot of people believe because they spend so much, they invested in their stomach, that they need to try to spot reduce and do crunches. Well, crunches will build muscle, but crunches do not burn fat. So, and it's the muscle that is so important, so that if you build that muscle underneath, it will burn calories throughout the day. So, in order to get that fat loss, the calorie burning, you need to go walking. You need to do jumping jacks. You need to do full body exercises that really start burning the muscles, really start burning the calories.
So it will help your stomach if you do total body exercise.
Absolutely. By doing a total body routine, it manipulates, it kind of encourages blood flow throughout your entire body.
Okay.
If you're just working on your tummy,
yeah,
then you're only really pumping blood to that area. You really want an all-over blood flow throughout your body when you're exercising.
Okay, good. So what?
And it really does make a difference. I mean, I'm someone who was the laziest person on earth since I stopped playing tennis as a teenager, and I have noticed, I haven't been able to meet Alana this past week, but I noticed in like 3 weeks' time a difference in my whole body. Everybody had.
I noticed it too.
All right, calm down. You know, it was a huge difference. There was a huge difference, and it's just amazing. Alana knows exactly what she's talking about, and again, it's not about having, oh, let me wait till I have thousands of dollars for the equipment. Oh, let me wait till I have 20 minutes a day. It's not like that. No, it can be so simple, and that's what I love about her too. Unfortunately, she makes it so simple. There's no excuse.
What about somebody who says, you know, I think I can reduce my arms just by doing a certain exercise. I don't really need to do anything else. What's your talk about that?
Well, a lot of people also feel like if they were to just do curls or just do triceps,
right,
they'll get rid of that genetic, what I call the wave jiggle, the tricep.
Right.
It doesn't work that way. Unfortunately,
okay,
you really have to get your heart pumping. Cardio, okay, combined with strength training.
Mm-hmm.
And you know, doing squats or doing push-ups. If you do push-ups, although it's a chest exercise,
right,
the secondary muscle is your triceps.
Right.
If you're doing a back exercise, the secondary muscle is your biceps. So it's good to do large muscle groups because you're still going to influence the small muscle groups as well.
I love it. I love it.
Okay, that's great. Let's say, okay, I have a lot of questions. A lot of people come for butt lifts, you know, or liposuction of the buttock. And that is a difficult area to operate on because in order to really achieve a nice aesthetic ideal, you're dealing with several curves that have to be smooth, and really I recommend exercising as at least the initial approach to that. What are some exercises that people can do for their buttocks?
Well, there's a few great ones. What's really important is that they're done correctly because there's so many knee problems. If you know, squats is a great exercise.
Okay.
to try to tighten up the buttocks, as you say. But it's important that you do them correctly. You keep the weight on your heel, so that you don't have that knee pain. You don't want to go in to improve one thing and hurt another thing.
Right.
Walking lunges, again, an extremely good exercise.
Love them.
Betsy would say.
Yeah.
And except there's so many ways to do it wrong that
Right.
you really have to be careful. So
Right.
even if you just get instruction once on how to do them correctly, so then you can follow through with it.
Okay, chiseledfitness.com is a place you can go to learn more about this. We're talking with Alana Bader, a private personal trainer par excellence. This is Talk 1260 KTRC, Western Medicine. Dr. Daniel Ronel speaking with Alana and my wife Betsy. Thanks for listening. We'll be back in a few minutes.